at the age of 19, I'd been unwell for a number of months. I'd seen my GP several times, and I'd been to A&E, and they were unable to diagnose me. I had low energy. I'd been losing weight for a period of time, and after speaking with a friend, it was suggested to me that maybe I should test for HIV. So I didn't at this stage feel I'd put myself at being infected with HIV. The test came back positive. I had been living with HIV for a number of years. This really devastated me at the time, and there was huge stigma around it, and I didn't really have a support network in place. I moved to Birmingham, this great city, where I could access better healthcare. I didn't really know anybody, so that gave me an opportunity to kind of re-establish myself and have a fresh start. However, this gave me a feeling of isolation, a social isolation. The earlier a diagnosis is found, the more effective treatment can be. For years it took me a long time to get on the effective treatment, actually get my CD4 back up, so there was many aspects of I found challenging for many years. Despite incredible advances made in treatment of HIV, there's still so much stigma and misinformation around the subject, usually because people lack information or they are have moral judgments and about how somebody may have contracted HIV. Stigma is often born out of fear and takes many forms, including physical or verbal abuse, and sometimes people are avoided or excluded from activities they might have previously enjoyed. Today I take one pill a day, and I see my HIV specialist once every 6 months. This year marks 20 years of living with HIV, and I'm living a long and fulfilled life. I think that's a really key take-home message. We need to deliver key messages around U equals U, undetectable equals untransmittable. This is a U equals U campaign that hopes to spread awareness that medication for HIV are extremely effective. I know that I'm not going to almost transmit HIV as my viral load is undetectable. I just want to touch on PrEP very, very briefly, but a PrEP is not reaching the right groups at risk of contracting HIV. The government should fund targeted community outreach to expand PrEP as a key step to ending HIV transmission by 2030. So when I moved to Birmingham, I established a new friendship group. I spent much time socialising. This kind of naturally led to more time partying, more time socialising, more, should we say, drug and alcohol fueled at times. So for instance, we'd go clubbing where we might have a line of coke or some ketamine. This would lead to GHB and ended up injecting drugs. This was over a period of time, and obviously I put myself at risk of STIs and also hepatitis C. At this time my health was really quite poor, and my health and well-being wasn't in the best place. I tried all the time. I had difficulty concentrating. I lost my line of thought then for a minute, but I had brain fog and felt depressed at times. This was because I thought this was because I was living with HIV. But after routine bloods, I was actually diagnosed with hepatitis C. And this, I guess, was down to my chaotic lifestyle at the time. I think nowadays, many factors discourage people from agreeing to testing for hepatitis C. I guess this might include privacy, but there's also other aspects as well. So some people fear a positive result, fear a lack of rejection by peers, and some people feel they have the freedom to access testing and actually knowing if they put themselves at risk. So I started hepatitis C treatment and interferon treatment for 48 weeks, and this gave me really poor mental health. I constantly had flu-like symptoms, and I had no energy, and at times felt suicidal. It wasn't really the best treatment which somebody was suffering from mental health. So it was agreed with my healthcare professional that I was taken off treatment halfway through due to the side effects. So at this time I didn't cure hepatitis C. Moving forward, we're now in a new era of hepatitis C treatment. It's a simple course of treatment. This does not contain interferon, consists of pills, and most importantly, no injections. Medication is taken over a shorter duration with fewer side effects. So the second time round, I prepared myself for treatment. I engaged in tailored care, which actually suited to meet my individual needs. Within the first 3 weeks, I saw a huge change in myself. The jaundice had gone, my brain fog had gone, I didn't feel I was struggling as a day-to-day, and I felt more active. What was really challenging was to continue the treatment for the duration, because I actually felt well in myself. Hepatitis C has really affected my life in many different ways. I've had many challenges with it. It's impacted my family, my friends, it's affected the wider community and also my career as well. Just to summarise, I feel people need multiple options of test location, the timing of tests and method of testing. People value the healthcare offered to them, and being supported by their peers, they're more likely to accept testing, as well as education around transmission, treatment and reinfection. I feel like programmes like the Hepatitis C Trust, peer programmes can be perceived as a credible source of help and empower participants to help themselves, as I did. They can provide means of transferring knowledge, can be non-judgmental, provide learning opportunities through role modelling and be beneficial to trained peers. So we have an opportunity to end the HIV and Hepatitis C epidemics by 2030. This requires commitment from us all and resources. So please, let's leave nobody behind. Thank you very much.